Welcome to Soul Wellness with Kristen, where we get into the nitty-gritty of various holistic modalities and explore exactly how they help you heal. I'm your host, Kristen, and I invite you to join me on this enlightening expedition where we explore the connection between mind, body, and spirit. In each episode, we'll talk in depth with holistic providers, medical professionals, therapists, and healers. Our goal is to empower you with knowledge, inspire you with stories of resilience, and provide practical tools that you can integrate into your daily life. So, find a comfortable space and join us as we explore the multifaceted world of holistic wellness. Get ready to learn how to improve every aspect of your life and simply feel good. The adventure begins now. Thank you for joining us. Today I have Melody Mattingly with Relaxed Therapy with me. Melody is a licensed clinical mental health counselor who practices here at Soul Wellness. So welcome, Melody.
Thank you very much. I appreciate you inviting me to be here today.
I'm excited to have you, and I hear this is your first podcast.
Yes, first ever.
Yay! How exciting. Well, we are going to spend a lot of time today talking about trauma because I feel like you are such an expert on that, and it seems to come up in just about every podcast that we do here because each of these holistic practitioners work with it in some way. A lot of people do body work here, and trauma seems to be stored in the body, so I'm excited to talk to you about trauma and get some good information about it. So start us off, tell us the difference between a psychiatrist, a psychologist, and a therapist.
Great question, because in my initial consultations, which are free for clients, this almost always comes up. They're like, I don't know where to begin. Mm-hmm. So it's helpful to know a psychiatrist, they're the top of the ladder. Okay. So that's an actual MD doctor. So they're fully licensed as a regular doctor, but they have a specialist in mental health medicine. And they can do therapy, but it's extremely rare that they will. They mostly just focus on the medicine aspect of it.
Okay.
And so, it's, we're looking for mental health meds to help with different diagnoses. That's who you go to.
But they like to refer out to a counselor or a therapist, or do they even refer to psychologists as well?
Yeah, they sure can.
Okay.
It just kind of depends on what they see that the client's going to need.
Okay, so then tell us then the difference between a psychologist and a therapist.
Well, basically, psychologists and therapists are on an equal level of education.
Okay.
The psychologists, they're going to focus mostly on testing. So they do a lot of ADHD testing. They may do the diagnosis of a developmental delay or anything like that.
Okay.
So they really focus a lot on testing. They get paperwork done that you might need for different services. They can do some counseling, but mostly they typically do the testing part.
Okay, I did not know that.
With the psychologists, some of them also can prescribe some medicines. That's kind of newer to my knowledge. It's not the same as going to the psychiatrist, but some of them are able to prescribe some medicines.
Okay.
I don't know a lot about that, so I don't want to say a whole lot on that one.
Okay. But the counselor, like yourself, a therapist, is going to see somebody regularly.
Yes. So now we're looking also at a master's level of education. And so we get lots of different labels. So you can be a counselor, psychotherapist, therapist, mental health therapist. That is all one and the same.
Oh, okay.
So you hear a lot of the terms going around, and so it's kind of helpful to know, well, that's not all different things. It's a mental health therapist, so we're not prescribing medicine, it's talk therapy.
Okay. This is great information. I did not know any of that. Tell me the definition of trauma according to the American Psychological Association.
Yeah, I like the way that they really defined it on there. So it's an emotional response to a terrible event that can cause shock, denial, flashbacks, and more. So the emotional response is the biggest part to know that it was traumatic to someone, because it's how we respond to something that happened.
But from my understanding, trauma can be sometimes the slightest thing, can it?
That's exactly right.
It does not have to be something horrific, because you think in your mind trauma is like, maybe seeing someone in a fatal car accident or something traumatic before your eyes, or something traumatic happened to you, you were violated by another person. But it can be just maybe you didn't get the emotional support that you needed or something that you needed as a child, and that became traumatic.
Exactly. So if you pay attention just a little bit on that, an emotional response. Now, they did use the word terrible event. That's their opinion.
Right.
It's just an event. So your personal emotional response is exactly what you were just saying. So how you respond to something, that makes the difference if it's going to be traumatic or just, oh, that just happened, not a big deal.
So when you are counseling someone, how are you uncovering those layers where you can help them discover the trauma, discover the source of what's creating the problem?
A lot of times they come to me because they're having symptoms.
Okay.
It's either I've got distressing dreams, I'm very anxious, I can't leave my house, it takes just the slightest thing, my brain goes back to what happened, I feel stuck, I can't get past this. So there's a lot of different symptoms people can experience, and a lot of times that motivates them to go to therapy.
So they full well know what has traumatized them at some point in their life. They know what they need to work through, it sounds like. But then there's also a subset of people that may not even realize they're carrying around something traumatic because they've suppressed it.
That's one of our coping skills as a human. It's a survival skill.
Okay.
We can suppress trauma because our brain has processed it as this is too difficult to handle, it's causing too much pain. We're going to put that way over here. We're not going to deal with that because that causes too much uncomfortable.
How do you help somebody figure that out?
Well, it's helpful if they have a place to start, like, they give me a symptom. So what we want to do when we're looking at trauma, it helps with years of experience too, because you kind of get to see, okay, I see an underlying thing here going on. And that's helpful because they present me with an issue, but yet when we start to work on it, things are not getting better. And then I start to see, okay, there's something deeper here that we're missing, and so then I know to explore with them a little bit more.
It's so interesting. So they're presenting with maybe anxiety or depression or something, and as you know what to ask, and as you're working through, then all of a sudden you start to uncover something.
Well, we do the initial intake where I ask a lot of questions, I get a lot of background history. Those are very helpful to begin with, and then we look at their goals. And if I see a huge gap in missing information, a lot of times that might be something that a person has suppressed. So they're having symptoms that are coming up, but they don't really know why. Or they may think, okay, well, this is just my norm.
Okay.
So that kind of helps. You look for little clues, and then your client is the expert. So I can ask questions, and we see where the questions go. And so if they start moving backwards, avoiding, or really blocking a question, then I know we've hit a nerve. A lot of times the tears start. And I have to be very comfortable with tears because that's where the work needs to happen so they can heal.
Right.
And so there's, like I said, there's little tells along the way. It's like, they tell me all about the relationship with mom and everything, and we barely mentioned dad. And I asked about, well, how was your relationship with your father? And if there was physical abuse in the home. Like, yeah, I didn't spend much time with him. And then we start talking about something else. Okay, that's an avoidance clue to me.
Right.
We just passed right over dad. Why did we just avoid dad? There might be something there, so I explore it. There may not have been anything there, but we can explore that a little bit so we get more clarity. And if there is, a lot of times, then they will start to disclose a little bit more.
Wow. But you have to establish safety and comfortable for them to even start to go down these paths with you.
Yes, very definitely. We call that rapport.
Rapport. And how
Yeah.
long does that take? Does it just
Every
depend?
person's different. Yeah, and again, it also can depend on how avoidant they are. So sometimes it takes a while to where, I'm going to go by your lead because you don't push people where they're not ready yet. So you can suggest, you can, throw out different things for them to kind of ponder on. Sometimes I sneak in a lot what we call psychoeducation. So I'm discussing, common symptoms that may happen if you've had this trauma or things like that, so people can kind of think about it. And then when they're ready, they will start to delve in it a little bit more. But you're right. If I push too hard, too fast, they're going to pull back.
Right.
And I can do damage. So not the goal.
Right. You feel like everybody has trauma in some form or fashion, just being a human being?
I think it's safe to say we all experience very difficult things. Whether we've labeled it in our brain as traumatic or not is an individual thing as well. Most people, you ask them, they're going to say, yeah, I had a trauma.
Right.
And it can be anything. But yes, so as a generalization, most people, yeah, they've been through some really difficult things in life.
Do you feel like it's mostly through childhood that's experienced, or where at least it starts?
It's the most common, but that does not mean that it can't happen later on in life too.
Right.
Some people have a very healthy, very supportive childhood, but then, maybe they got into a relationship 19 years old or something like that, and it's an abusive one. So, boom, here comes trauma, and they've never really been through it. They don't even recognize that it's starting to happen. So it can be at any point in a person's life. A lot of times you'll see people that have multiple traumas because it's, for lack of a better word, it's familiar. They know how to survive in that atmosphere. And so they're almost actually drawn to a person who has some of those same traits that they grew up with because they know how to survive in that.
That makes a lot of sense.
So they did not enjoy the abuse or the trauma they went through whatsoever, but they know how to survive in it, so it feels familiar. It feels like home. And without even knowing it, they will be in a relationship that's starting to mimic some of those things.
Well, you always hear that. I've always heard that my whole life, is that you will gravitate to somebody that may remind you of a parent or something like that, and it's almost like it's your chance to rework. Or, like you said, you already have the survival skills for that, that type of relationship. That's really interesting.
That's not to say it has to happen.
Right.
If people do recognize it and they start working on their trauma, you can heal and not have to go through relationships with, dealing with the same things.
I bet it is such a great feeling when you're working with somebody and you start to see the healing process and then the behaviors start to change.
I absolutely love that part.
Yeah, that's got to be really rewarding.
Very, extremely.
Do you teach people coping strategies? Because you said
Yes.
coping strategies is also, that's a signal to you if they're suppressing something or something, burying something, but you're teaching them probably proper coping skills.
I like to call it healthy
Okay.
coping skills.
Okay.
Because we all use coping skills, and a lot of times they're effective. They work, but they may not be healthy.
Okay.
For example, if I don't want to think about, maybe I grew up with a lot of physical abuse, domestic violence in the home, I don't want to think about that and it pops into my head all the time. I might drink, I might use drugs, I might, maybe I want to go shopping anytime I feel bad. Ever heard of retail therapy?
Oh, yes.
Which is not bad if you can afford that, but if you can't, this may not be healthy.
Right.
So what it's going to do is it's going to relax the body from that thought for a little while, but it's not really healing the underlying cause. And of course, the alcohol and drugs, yes, they are going to numb. You're not going to think for a little while, but then you also have the issue with addiction.
Right.
Which, okay, that complicates the entire life.
It does.
So it's not a healthy one to deal with our stress and trauma.
Because the addiction then kind of takes over.
It can take over the entire life and every part of it.
And then you're numb. Aren't you just kind of numbing yourself to?
Yes.
Yeah. Yeah. Not really working through anything.
So again, if the goal is I don't want to feel right now, yes, it works. It's just not a healthy long-term solution.
Unless you want to just be numb the rest of your life.
Yes.
Maybe. Maybe.
But that's it. You can't just stay numb with addiction. It's also causing other issues
Right.
that are devastating.
So tell me some healthy coping strategies.
So number one, what I like to do is just get people to kind of realize that emotions, everyone has them. They're not the enemy. They're actually just messengers. And all they do is give us information that something has happened. So the biggest part is people are afraid to feel, because sometimes those feelings get intense. I don't want to feel pain. I don't want to feel hurt. And if I think about those things, those emotions come up, and that's very uncomfortable. So first we need people to realize emotions are actually helpful. We don't want to get rid of them. If you stick your hand on a hot stove, how does it feel?
hot.
Okay.
Hurts.
It hurts.
Yeah.
And we feel pain, right? And so what is our response to that pain? Your hand's on the hot stove. You now feel pain. What are you going to do?
Yeah, you're going to pull it away, scream.
Sure.
You might even cry.
Yes.
Yeah.
So we wouldn't do that if we didn't have the feeling with it. So if we really didn't feel pain, we might leave our hand there. That doesn't mean it wouldn't burn. We just wouldn't know it until, your hand is very burned. So the emotions are messengers. Something happened. You're feeling this for a reason. So we don't want to just get rid of them. We need to pay attention to them and see what they're telling us. So step one is we can have emotions. They might get intense, but they won't stay that intense forever. It's like a wave in the ocean. A wave can get really big. It might smack you down, but the wave doesn't stay stuck up in the air.
Right.
It always comes back down. There will be some relief. There may be another that comes up, but we will have those moments of relief. So emotions won't last at that intensity forever. It's impossible. So once we realize, okay, I can have a feeling, I can be okay, then we learn, okay, let's pay attention to your body. How did your body just change? Did you get tense? Did your breathing change? Did you feel like I need to move? I can't stay inside of my skin right now. I've got to be doing something. So seeing what your body needs in that moment, and then that's what we do. Okay, let's practice breathing techniques. Let's do tensing, relaxing techniques. We can do mindfulness skills, which is using your 5 senses to explore your surroundings.
Being present.
Yes.
Yeah.
So let's say you need to walk outside just to calm down. That's fine, but if your brain is still thinking about everything that's making you really, really anxious, that's not really going to help.
Right.
So thinking, okay, what do I see right now? Let me take a breath. What do I smell? What do I hear? So, hear, taste, smell, touch, all of our 5 senses, we engage them. It's grounding. It brings you back into this moment to where, oh, my body starts to relax. So we need some of those skills before we start tackling trauma.
Right.
Because we need to, if we start talking about this, I don't need to send you out and you're all keyed up. What do I do now? That's not helpful.
Right.
You need to know how to be able to start calming your body down so that the intense emotions can come back down.
This is great information. Tell me about how you measure progress with a client.
As I said on the intake assessment, I'm also helping them set goals, what they would like to see. That's how they're going to measure their progress. What's going to be different? Are you feeling less anxious? Are you getting more sleep? Do you feel like you can talk about past trauma? Are you functioning better at work? There's a lot of different things people might choose as their goal. So that's really a helpful check-in to see if those things start to happen.
If you're starting to move that needle a little bit. What are some of the typical issues that you work with clients?
The most common are anxiety, depression, and trauma. That's a very common one.
How about grief?
Yes, and grief can also be included in the trauma definition.
Tell me about the treatment modalities that you use.
Okay. I don't use all of these, but these are things I think would be helpful for people to know that have been through a traumatic event that's really affecting their life.
Okay.
So EMDR, eye movement desensitization and reprocessing. A lot of people are actually trained in this. I personally am not, but it's a very good treatment. And that one, they're really working with people being able to talk about what happened, to where if they have some of the things that are suppressed, they're covered up, it really helps it to surface so they can face it. And then it's so interesting because the brain sometimes gets stuck when there's a traumatic event. And so they're really using the eyes, moving back and forth, which triggers the brain to start to release as they're talking about their trauma. And it's done slowly, it's done very well, but it actually is very effective. That's one of the, with a lot of the veterans, a lot of times they will have that kind of treatment.
Okay.
And it's been shown to be very effective. What I really use right now is the internal family systems. I don't have a certification in that, but I use many of the tools from that.
Okay.
Which is a very powerful modality. And that one is really looking at how we conceptualize the different parts of us as a human. So let's say that I was sexually abused as a child, and that was a really traumatic event. I've kind of put that part over to the right side of my brain, and I just kind of put that young girl in there, and I shut the door and locked it because we're not going to go near there because that one hurts.
Okay.
Then maybe I got married and I'm in an abusive relationship. My husband is verbally abusive, says awful things to me. I don't really want to think about that one either, so I put that over on the left side. I shut that part behind the door and lock it. Okay, even though these are gone, symptoms from it come out. So I may be triggered by something. That little girl who's locked up, she's going to have a fit when something reminds me of some kind of sexual abuse.
I was going to say the triggers are there no matter how
Yes.
many locks you put on that door.
Right.
Yeah.
They don't go away
No.
until we finally heal them. And so it's not just uncovering, it's not just talking, but we also need to heal that part. And that's where I love the internal family system style. It's because it's getting to know, basically you treat the different parts of you as if you're talking like you and I are across from each other. We let it be a separate entity. We're not schizophrenic.
Yeah.
It's just we have different parts of us. But if we step outside of ourselves, we can actually deal with it. Because the adult part of you knows how to heal. Every adult actually has this spiritual component to us, we're born with it, that knows how to heal. No matter what you've been through, no matter what kind of trauma, it's there. And that's what's so powerful.
I love that.
And that can actually heal. We listen to the young girl part, we hear her story, we ask her what she needs, we find out, basically you're reparenting, what would you have rather heard? You know, what would you have rather happened? And we provide that inside of our head to that part of us. We let that part join us. So now she's no longer locked into a corner. We've healed her. We've helped her release that unhelpful belief. Maybe she thought it was her fault. She felt guilty. She hates the world because of it. She's able to release that. She joins us now, and she can have a whole new role. She can help us have fun. We get the childhood fun we never could feel.
Right.
So it's a connecting instead of the dissecting. As long as we stay locked up to different parts, we feel very disconnected. We can't hardly experience joy or happiness because we're in a million different parts. Richard Schwartz, he has his 8 C's. That's when you start to experience curiosity, calm, confidence, compassion, creativity, clarity, courage, and connectedness. So in his research, he saw all those really start evolving as people healed themselves.
I feel like you just gave us all a pearl. We can all use this information
Definitely.
to do a little homework on ourselves.
Yes. And a lot of his books, he has workbooks and things also, which do describe how you can totally work on this yourself.
Okay. That is great information. I meant to ask you this in the beginning as to how long you've been doing this and what actually drove you to become a counselor yourself.
I've been in the field for 12 years, and obviously I'm not fresh out of college, typical college age. So it was a journey getting to this point in my life. Actually, in the early to mid-20s, my sisters, I have 2 sisters, and they both got divorced. And I noticed they really needed to talk and process and talk and process. And the thought that went through my head was, I wish I had really good, helpful information for them.
Oh, wow.
And so it really kind of motivated me, like, you know, I would like to be able to help people like that. Luckily, you know, they said it was good just to be able to have someone to talk to, so it wasn't wasted. But it did start to motivate me. So fast forward, I opened up a daycare in my home, just trying to help pay bills, you know, put food on the table.
I did not know this about
Yeah.
you.
Yes. My kids were all in middle school, and so I said, well, I can still be home with them partly, and then also bring in some money for the family. And so I started doing that, which I love. The children are awesome, but I realized very quickly I don't want to do that the rest of my life. That was not going to be my journey. So I started going to school, community college at night. So I'd work during the day and then take a class or 2 at night. I said, I'm going to take psychology just to see if I like it. So went to the first class, absolutely loved it. And so then my journey began, and I just slowly went through school as it worked out in my schedule. And so each part of the journey, I could really see this is what I want to do.
Yeah, you're definitely following your soul's path because it lights you up, I can tell. Yeah, it's very, very rewarding for you to see these people change, and that must be the most incredible feeling to see these people change their lives and be happy.
I feel very honored and humbled by it, to be able to be a guide to help them through the journey. And yes, it is so rewarding. I love it.
Yeah. And the great news is that you take insurance.
Yes, I do.
So tell me about the plans that cover you.
Blue Cross Blue Shield of North Carolina. There are some other parts with Blue Cross Blue Shield that I can take. It gets a little confusing sometimes, even for me. But also Cigna, Aetna, and Optum. Okay. And inside of those, there's also UMR is under the Optum, different ones like that. So check and make sure that if you have those insurance, look to see if there's other ones listed under those particular titles that are also in network.
And you, I think, mentioned in the beginning that you do free consultations.
Yes.
That's perfect. Tell everybody how to find you. What's the best way to find you?
Just go to my website, relaxtherapy1.com. The one is just a numeral 1.
Okay.
And you can sign up for a free consultation right on the website. You just choose virtual or in person, and then we talk and see where we go from there. If I'm not a good fit for you, that's literally what the consultation is for, so we can make sure it's a good rapport, so I can have clients that fit with me. If not, then we work on referral places so that you can find somewhere else that will be a benefit.
Okay.
So it's not just, yes or no, it's, hey, let's make sure you get the help that's going to be best for you.
Perfect. Well, thank you so much for joining me today. This
Thank
has been
you
a
for
lot of
inviting
fun,
me.
and I've learned so much from you. This is great.
Oh, well, thank you very much. I appreciate it.
Yeah, and you can also be found on our website as well, www.soulwellness.net, and I'm sure that I'll have you back on this podcast, and we'll have a whole new subject to talk about.
Well, thank you very much. I look forward to it.
Yes, thank you. Thank you for joining us on another enriching episode of Soul Wellness with Kristen. We hope the insights shared today have resonated with you, inspiring a deeper connection to your own journey towards holistic well-being. If you enjoyed today's episode, we invite you to subscribe, share, and reach out. Your feedback fuels our mission to bring you meaningful content that educates, empowers, and uplifts. Remember, you are a vital part of this community, and together we're creating a ripple effect of positive change.